Welcome to the Mind Design Sports Podcast. I'm Brandon, and in each episode, I'll be talking about sports psychology with the guest speaker. If you want to design your sports experience, you've come to the right place. If you want more tips and insights on how to improve your sports performance mentally, check out our website and other podcasts at mind-designsports.com. Hello, everyone. Thank you for joining. Today, we have a really special guest with us, Keagen Hadley, who is a Doctor of Occupational Therapy and a psychiatric clinical researcher who specializes in using psychological treatments such as ACT, or better known as acceptance and commitment therapy, with his clients. He's a deep understanding of the interventions and knows how emotional distress can interfere with rehabilitation, daily activities, and overall quality of life. We'll talk about physical therapy, ACT, how it all relates to sports, athletes, and sports psychology. Thanks for joining me, Keagen.
My pleasure, Brandon. Great to be here.
My first question is, talk about ACT. What is that, and how can it be applied to athletes?
Yeah, so ACT is acceptance and commitment therapy, and I came upon it because after I tore both of my ACLs, I kind of went down a dark path. I was extremely angry just due to the loss of opportunities. I would lash out at family members, friends, and those kinds of things. And I started to make really poor decisions, abusing substances. And also, I ended up in a relationship with who I would find out would be a pretty severe alcoholic. And due to that relationship, I endured a lot of emotional abuse, and I ended up being suicidal. I'm just kind of giving you the backstory. So due to that, I obviously knew I needed to make a choice, with where I was going to go in life. And I decided to get out of that relationship and then get help. And when I went to therapy, this is when I actually got even more frustrated, because I was going to therapy. I was doing everything I, perceived I needed to do. And I wasn't feeling like I was getting any better. I've always had this perseverative, negative thought, even before I screwed up my knees, that I am broken, just because of all my, mental issues I've had in the past, severe anxiety, panic attacks, those kinds of things. And so that thought would always be with me. And it only got worse after that emotional abuse. And then I tore both my ACLs. So I really perseverated on that thought, I am broken. And when I would go to regular cognitive behavioral therapy with my therapist, I was just very frustrated, because I would have that thought, and then we would try to talk about, things to think about instead of it, to try to redirect it. And, no matter how hard I tried to, redirect my thoughts, it almost gave more and more power to that thought that I am broken. I'm one of those people where you can't say look over there or don't look over there. I'll stare over there, and I'll repeatedly look over there, and that's kind of how my brain works too. So I scoured the internet, and I found ACT, and acceptance and commitment therapy, and I found another therapist and tried it. And within the first 10 minutes, I had a kind of a minor breakthrough that really has changed my life, and I've continued to move along that path for a number of years now. And that subtle difference is, instead of having that thought, I am broken, you give yourself the space to evaluate that thought and realize that you are not broken, but I am having that thought or feeling that I am broken. And if it's not, conducive to you moving towards the values you see fit in your life, you can just let it pass. We all have all kinds of crazy thoughts all day, every day. So that's kind of in a nutshell what it is.
Thank you. Yeah, thank you for sharing your experience and your background. Like, it's not an easy subject to talk about, like, going into suicidal thoughts and having, tearing your ACLs. Those are really tough. I personally dislocated my leg, and it was probably the worst 2 months in a really long time. So yeah, definitely feel you. Do you want to explain to the audience how ACT is really unique and different from other methods such as CBT? What differentiates it, and also why is it similar to other techniques?
Yeah, so it's very similar, but it kind of has a different goal in mind. So CBT wants you to, its whole goal is to minimize the negative symptomology that the individual is feeling. Like, I deal with patients who come in who are struggling with depression due to their physical injuries, and they come in wanting the depression to just go away. That's kind of what the lie they've been told is, as soon as you take this drug, you do this thing, you do that thing, you know, um, your negative symptomology will go away. But that's not really the case. I mean, it's part of life. It's not going to go anywhere. But the thing is, it's how you deal with it, and you can minimize it to where it's just something kind of playing in the background, because there's no control alt delete for the brain. Unfortunately, if there is one and you find it, let me know. I would definitely like to use it on a few things. But essentially, what it wants to do is allow you to live a life more fully, with those feelings. It gives you the different skills necessary in order to function as optimally as possible. So it's just the different in what you're trying to achieve and how you go about it.
Gotcha. I like how you said like it doesn't just go away. It's like how you deal with it. I don't know if you know this guy, but his name's David Goggins. He's an ex-Navy SEAL, and he always talks about how like you have to, figure out what's really bothering you and your insecurities and deal with it. And that's when you can push through and kind of deal with adversity. So I think that's kind of connection there, and I like that.
Yeah,
Um,
you have to sit with those hard thoughts, hard feelings. Otherwise,
right.
um, they're not going anywhere, unfortunately.
Exactly. So how does your work, what do you do specifically for your work? Like, do you only deal with athletes that have gone through ACL, or really in general, just with using like the ACT approach?
So using ACT, I treat both. I treat athletes specifically who have went through a joint injury that takes an extended period of time to recover. Most prevalently, that's obviously an ACL injury, an Achilles injury. Those are the main ones I've dealt with, and I kind of meet with them very similar to how we're talking here. It's obviously not corded or anything like that, but I walk with them and help them cultivate. There's 6 different skills associated with ACT that if you really work on them, you can live, the best life you can each day. Obviously, that's not going to be perfect. There's going to be hard days and stuff like that, but it gives you those resources that especially athletes don't have at all. A lot of times athletes kind of scoff at the idea of mental health and those kinds of things. And I'm trying to reframe that a little bit, because a lot of the research I did for my book is I knew that going into it. My book is for athletes or people who deal with athletes who don't necessarily, maybe they don't love to read and they don't love research, but they do love playing well in their sport. And what I found is people who really work on psychological flexibility actually have been proven in studies to perform better athletically. So I'm trying to rebrand it a little bit. So
Yeah, of course. I definitely can agree with that. Like the athletes that start off early with sports psychology, like enhancing their mental game, they're definitely gonna have an edge, and they can always build upon that when they keep getting into more, competitive leagues or playing against more competitive, opponents. So yeah, definitely. You mentioned psychological flexibility. What do you mean by that? That's interesting.
yeah, so psychological flexibility is kind of the general term for acceptance and commitment therapy. It's essentially used kind of in tandem. It undergirds like it's kind of like an umbrella. So under this psychological flexibility umbrella, you have acceptance and commitment therapy, relational frame theory, and it's essentially contextual behavioral therapy. So it's kind of an overarching umbrella that has all of those different components in it.
I see. Gotcha. How can an athlete that hasn't gone through an injury utilize, the ACT approach? Can they? Do you think they can? Can it be applied with people in real life that don't do sports but have gone through trauma?
Yeah, certainly. So my book, Torn, Overcoming the Psychological Challenges Post-ACL Injury, I made a very targeted title, and I'm really glad I did that. But also in some cases like this, it's rather unfortunate, because while I talk about my ACL injuries and stuff like that, it's also just about life in general. So I mean, we're all going to have, maybe you don't play sports, maybe you're just in a stressful work
Yeah.
environment. These psychological flexibility skills, there's 6 of them. If you work on all those and get better in each area, you're only going to make better business decisions, better decisions in the middle of the game, those kinds of things. It's in my opinion, it's much easier to gain your ability in these skills prior to having some kind of catastrophic event occurring. I'm not saying it can't be done. That's why people like me are here, but it'd be much easier beforehand.
I see. If you had to take one lesson away or one advice or any piece or story from your book, what would it be?
Hmm. I think one thing that everyone could benefit from, maybe you're not even having a hard time right now, but one thing that I really try to focus on in my life is mindfulness. And I don't mean from a spiritual aspect or anything like that, which could be very beneficial as well. But what I mean is we're always involved in 14 different things at the same time. We're on Instagram, we're on Facebook,
Yeah.
we're on TikTok, whatever the case may be. And we're not really living in the moment. I don't know if you've had a similar situation, but I've just spent like 25, 30 minutes scrolling. And then I look around at all the stuff I probably should have been doing, or probably should have been enjoying the company of, my family, or just missing out on life, watching someone else do something stupid on the phone. So I think one thing that would be huge, and that's kind of where a lot of people start with psychological flexibility, is just becoming present in the moment. Because if we're looking forward, we're likely anxious or worried. We're looking back, we could be depressed, those kinds of things. If you work on what you can in the present moment, a lot of people would be a lot happier, I think.
Yeah, like living in the moment. And also like I feel like meditation also helps with that. Like you kind of centered and you are just focused on your breathing and what you're doing right now instead of the future or the past. So I
Yep.
definitely agree with that. Um, do you think the ACT approach can work with people that don't have trauma? Can it be used and applied for, small stresses that are day to day, or even like, anxious feelings that one can have in anticipation for a big event, maybe a big game or big test or a big musical performance?
Yeah, certainly. And how I could explain to you how it's felt for me. So I have I get very, very severe panic attacks, and it would feel like before I started this, like I was going to have a heart attack, essentially. So I mean, they're reasonably severe, but through these skills, and it's not like I don't get panic attacks anymore, but I'm able to live with them much more easily. Like I could have one. I had a panic attack during a podcast, not this one, but I've had one before, and I was able to still fully go through the entire interview, whereas in the past I wouldn't have. So if you apply that to someone who maybe doesn't have as much stress, maybe they don't have any formal diagnoses, but they do have a stressful test coming up, they do have a stressful meeting, I think it would be very beneficial, and they will still have stress, but they'll actually have the tools to deal with it appropriately and in a healthy way, which a lot of people don't have that. So,
How can someone actually use ACT? Like, do you recommend somebody like go see a therapist, or is it like, like guides online or YouTube videos online that kind of guide you, or is it just something that, you learn once and you just apply it and you know how to use it for the rest of your life now?
I still speak with my therapist. Not as often as I used to, but I still speak with them quite a bit, and I would say that they're extremely helpful. But if someone's really interested in ACT, I would have them check out Dr. Stephen Hayes. He's essentially the godfather of the whole scientific literature that's been coming out since I think the 70s. So, but as far as day-to-day application, I think it would be best taught by either one of those books from Stephen Hayes. My book gives a very large overview, but I don't think there's a ton of YouTube videos and stuff on it, just because even though it's been being researched since the 70s, it's still, all you hear about is CBT. So it's rather still unknown, unfortunately.
Yeah, I totally agree. Like, I personally known about CBT, and I feel like textbooks like AP Psych textbooks always talk about CBT and not like other approaches. So I think it's important for you and like other people to speak out on different techniques and approaches because like, everybody's different and everyone needs to find like their way because not everyone's going to be able to use CBT and apply it to their life.
Nope. And maybe someone won't really like the way ACT works either. I'm not saying it's a one size fits all thing, but
Yeah.
I think the name itself, psychological flexibility, it does make us this approach a little more conducive to fitting a wider net of people. So.
I also like the acronym of ACT, like acting to work out your problems, like being, having a growth mindset and taking charge and fixing your problems. So I
Yeah,
guess I like it.
It's
Yeah.
funny. One of the last actual skills, it's um, the one where, I mean, if you do all the other five skills, if you don't do the last one, I mean, none of it really matters, and it's purposeful action, which is kind of funny that, the acronym's ACT. So yeah.
Gotcha. Do you want to talk about some of the skills or any skills that you think are really important, or you can just even like kind of go through each of the six skills really briefly?
Yeah, so each of the six, they're in three different quadrants. There's acceptance, which isn't like acceptance, like kind of stand with your face in the corner and be quiet. It's, accept what happened to you. And now let's learn from it. So this, doesn't happen to us again and we can grow as a person. There's diffusion, which was the big one for me. It's instead of, I am broken, I'm having thoughts or feelings that I'm broken, looking at thoughts just as what they are, thoughts. There's mindfulness, which we've spoken about. It's obviously living in the present moment because, that's where we don't have worry or, anxiety or depression. Obviously, there's self is a context, which this is going to be the hardest one for people to kind of wrap their head around. And it's the one that was the most challenging for me. So self as a context is essentially that it posits that there's two different versions of ourself every day. There's the persona and the outlying, personality that we're trying to portray to others. Like, for example, I was a football player for a long time. Football players are, notoriously, supposedly tough, no feelings, cool, strong, all those kinds of things. So, I mean, trying to fit into that box is one, so I myself was trying to fit into that box for a long time. And I can prove to you that everyone has this particular struggle. Now that I tell you this, you'll probably notice it a lot more, but go throughout 1 week. And if you have a notebook with you, or maybe even just your phone with the notes app open, count how many times you tell a very, very subtle lie to make yourself look just a little bit better. An example would be you come into class late one day, and your friend asks you why you're tired, and you say, oh, well, I was up, playing Fortnite or whatever till 3 a.m. And the truth was you actually went to bed at 2 or 2:30. Well, why did you say 3?
Oh yeah, I see.
It's stuff like that you're trying to make yourself look better. And it's very prevalent in athletes where, for example, maybe you're going through rehab and, you're starting to squat again. And someone asks you, oh, well, how much did you squat this week?
Yeah.
Maybe you squatted 225, but you say you squatted 275 just to make yourself look that a little bit better. And that's proof that there's some kind of internal struggle that you have, and you might not even know why you did it right after you did it. And it shows that it's there. And us reverting to our true self is when we will be the most happy. So.
Interesting. Yeah. Do you think that's like a big problem when people like do that subtle, like, like making yourself look better, or like, for example, like your example, like it's not a big deal. Like, oh, if you stay up another 30 minutes later, but can that translate into something that's more of a big deal and have major consequences?
Well, it's been shown in literature actually that the more tied you are to your own perception of yourself or how you want to be and not how you actually are, can actually change your thoughts. So thoughts actually won't come through the brain synapses that don't align with your self-perception. So I mean, it's very interesting the way the brain works that way. But I think it's something that everyone should be aware of, because there's no reason to. The only reason you're doing that is to it's the yearning to be special.
Yeah.
Essentially is what you're going for. No matter what that little lie is, it's a yearning to be special. Oh, I was up so late, look, I'm still in class. Those kinds of things. And to realize that it's not really truly going to make you any more wanted as a person to tell that little lie.
Yeah, I think that's interesting because it's more of like just being true to yourself and like kind of being honest with yourself. And I think that's important for not only athletes, but for people in general in life. You got to be honest in order to grow and improve yourself.
Yeah.
I was also looking through your website and I saw a couple of your blogs. I was pretty interested in some of a few, like, do you mind talking about like the connection between sleep and injury? Like, I know it's important, but why is sleep so, vital to someone that's rehabbing from an injury?
Yeah, so sleep is obviously huge. I won't claim to be like a sleep specialist or anything like that, but one thing that I did find throughout, my two ACL injuries and four knee surgeries is the better I slept. There was two rehabs in particular where I was focusing on sleep, and I rehabbed much easier. It's not like I didn't still go through troubles, but everything just seems a little less cumbersome, and it's because of the types of hormones that are released during deep sleep and those kinds of things. If you're neglecting getting enough sleep and as deep a sleep, putting yourself in the conducive environment to long and deep sleep, you're missing out on the necessary hormones that are released in certain stages of sleep. So
I see. Another one that you wrote about is, can you walk on a sprained knee, a comprehensive guide? That's just interesting. Like, it feels like a kind of like a frequently asked question. Like, always athletes are looking like, oh, can I play? Because it's just a sprained
mhm.
ankle, whatever it is. But yeah, like what did you find about that? And when you were writing about it, like, do you think there are certain injuries where athletes can try to play through it, or is it always advisable that, you kind of rest and do your therapy or whatever that's needed to, and then you can play?
I would say unfortunately, the answer is it depends.
Yeah.
It obviously depends on what exactly you sprained, your sport, your a lot of different. I mean, there's a lot of moving pieces here, but essentially, what I can say is there's a lot of evidence that people who say, for example, I tore my left ACL first, and I came back, and I was still 8 months out, and then I tore my right ACL because you favor that perceived injured leg if you're coming back too early. So that's what I think is kind of the risk, especially now that people are getting faster, stronger, those kinds of things. We have a lot of acceleration muscles, but we really haven't worked on the slow down muscles. So that's where you run into issues, especially if you're favoring one leg, that can put you in a lot of precarious positions.
I probably should have asked before, but how did you even sprain those two ACLs? Like, was it through sport?
Yeah, I tore both of them, and it was doing.
Hardcore, yeah.
It's okay. They I was doing the same exact move in football, so I played football through college and then briefly afterwards, and I was doing the same pass rush move. I played on defense, one going to the left, one going to the right. So
That sucks.
yeah, and it really sucks because I mean they were both non-contact, so it's very frustrating.
When you got the second ACL, like,
Mhm.
which one was worse, like mentally and physically? Like, after the second one, like, oh, again, not again? Or do you think the first time, because it's kind of like your first big injury?
Hmm. I mean, yeah, I've never been asked that. I would say probably the first one because that's where I mean, things got a lot worse for me after the second one. But the first one was where, I mean, no matter who you are, if you're an athlete, you play for a long time, you do feel kind of invincible. The whole premise of you getting a ACL injury just seems, so foreign, so something you'd only see on ESPN. But when it actually happens to you and you realize, I might I might never be the same. It really hits you hard, and that's why I really wanted to write content for these people because I distinctly remember. I'll never forget it. Those stupid bikes that they're not bikes, like carts that they have on at football games. Where the injured guys. I
Yeah, yeah.
always remember sitting on that damn thing and having just essentially the worst time of my life, and being all alone because no one's really equipped to handle what that individual's going through at that time. So,
Yeah, it sucks whenever like they bring out the car because it's a serious injury and like you really can't do anything about it and just wait, and you gotta just wait and grind through the rehab. So I totally feel you. Um, so do you think these two injuries have shaped you for the better or for the worse generally in like life? And how's it like change your perspective on mental health, particularly in sports?
mhm. So I honestly don't think I would be where I'm at today. Well, I know I wouldn't be, just because I'm fairly confident something else would have maybe transpired with sports, but also I've grown a lot as a person. Like whenever you have some of these traumatic events, whether that it doesn't have to be, a knee injury or anything like that, but if you have something traumatic in your life that you're having to work through, you grow as a person, and I think you become it's, in my opinion, I haven't seen any very many anyways examples of people who haven't grown and become an even more successful person. And it made me really clear on what my passion was, and it gave me a mission on the exact kind of people I want to help. So I wouldn't go back and change it, believe it or not. So
Yeah, I mean, I feel like the most hardest like challenges that people face, like you grow the most out of it, even though it could suck in the moment. Like when you look back at it, it's really like it really changes you mostly for the better. Like for example, a lot of like professional athletes, they like grow up in like either abusive, like environments, or they didn't have like everything given to them, but that kind of like made them work hard and
mhm,
kind of grind for themselves instead of having everything handed to them. So I feel like
mhm.
that's another like connection that you can kind of like connect with based off your story. Um, yeah, I mean, my last few questions were just like, do you have any tips or advice for younger athletes out there in terms of anything? Maybe that's like with dealing with injuries or adversity or anything with mental health. Do you have anything like that?
Yeah, I would say, don't be like me or many other athletes from the standpoint of, you know, um, discounting anything that has to do with, mental health or mental preparation for the game, because I think it's honestly the future. And I would say really focus on that. If you can cultivate those skills from, before you even need them, when you do need them, your life's not going to be completely derailed like mine was. So.
Do you have a certain like technique or something you say in your head, like a slogan or a quote that helps you get through tough times?
It's not necessarily a quote or a slogan, but I see what you're saying. Essentially, um, after practicing these skills for quite a while, I see, or I notice thoughts differently. Everyone does it a little different, but mine is kind of like I picture the wind in your head, because you can't control the wind.
Mhm.
So the wind will throw in some random thought, and if it's something I don't want, I just continue to let it go, I guess. And other people like the river with the leaves on it with the thoughts. There's a many different things you can do, but um, that's how I view thoughts now. It seems to be a little different, and you grow as you go through the process. So.
I think in sports psychology, technique that's similar to that is controlling the controllables. Like basically, um, focus on stuff that you can control, like whether that's your diet or how you prepare before a game. You can't control, like the weather on a football field. Like it's gonna rain or snow, but you're gonna have to deal with that just like everybody else is. And instead of getting like down on yourself, getting angry that it's snowing or raining, you can control how you're gonna respond to that. And if other people are going to respond negatively, I think that gives you an advantage. So I
Mhm.
think that's a really good ending note. Is there anything else you'd like to say to the audience? Do you have any future plans for yourself? Like, I don't know, goals or things you want to do in the next 5 years?
Yeah, so I have a note on my phone of 8 different book ideas that I'm kind of uh, working through if I would want to pursue them or not. But
Nice.
more in the immediate future, I'm going to be developing courses that kind of answer the question, like, hey, I'd like to learn about psychological flexibility. I'm an athlete, or I'm an athletic trainer. I'm a physical therapist, and I think some of these skills would be very important for my clients. So I'm going to be developing those by hopefully by this time next year. I'll be in full swing with it, but a lot of work's being done right now. So.
Well, good luck. And I think you're doing good things for, the sports community and people in general. Thank you so much for joining me. I really learned a lot, and it was a really important topic to talk about.
Yeah, thank you so much. Appreciate it, Brandon.
Thanks for listening to the My Design Sports podcast. Before you leave, please show some love for the podcast by subscribing, liking, and commenting. Stay tuned for next month's podcast with a new guest speaker.